welcome to Wholesome Living. I'm Donna again. Today I'm here at International Diabetes Care Center to meet Dr. Kautle Prabhakar. He's the Group Medical Director of Salah Medical, and I'm here today to know more about how to manage diabetes and also if there's a way to prevent diabetes. So doctor, just to make it clear for the viewers, can you please tell us the difference between type 1 and type 2 diabetes?
Okay, type 1 diabetes is basically seen in children. It can also be seen in young adults, but the type 2 diabetes is generally seen in older age group, in adults. The basic difference between them is that in type 1 diabetes, the children, because of some viral infection or something like that, they lose the capacity to produce insulin. So insulin is produced by a gland called pancreas, and in type 1 diabetes, there is inadequate or no insulin in the body. So they cannot control the sugar because insulin, the hormone which reduces the blood sugar, is lacking. Whereas in type 2 diabetes, they have enough insulin to start with, and this insulin may not be effective. So the insulin is there because of some reasons. The insulin is not acting the way it should act, and that is why the patients develop diabetes. And generally type 2 diabetics are obese, and obesity has got a factor, it plays a factor to produce resistance to the action of insulin. We call it insulin resistance, and that is why the glucose cannot get inside the cells though insulin is present. So insulin may be in fact be present in higher quantity, but still it's not acting well.
So can you give us an exact number of the population in the kingdom affected from type 1 and type 2 diabetes?
Okay, the Ministry of Health has produced the statistics on a time-to-time basis, and the latest available version of the statistics in 2013 shows that the prevalence of type 2 diabetes in males is about 14%, and in women it's about 12%. Whereas now in 2016 there was a speech delivered by the Associate Minister of Health, where he quoted the prevalence of adult diabetics to be 35%. So we know that the prevalence of diabetes in Saudi Arabia is growing in an exponential, alarming rate. Whereas coming to type 2 diabetes, type 1 diabetes, it is less, it's seen in children. So it may be in terms of, we say, 150 to 200 per 100,000 population. So its incidence or prevalence is less than 1%. We should also keep in mind that though prevalence is a general figure that is given, there is a geographical distribution or variance of the prevalence of diabetes. For example, in Hale province, the prevalence of diabetes is the highest, and in Jizan, the prevalence is the lowest. And the prevalence also depends on the age. If you take the age group of 65 years and above, the prevalence is 50% above. Whereas if you take the prevalence between 14 and 15 years, it could be about 5 to 6%. So as the age advances, the prevalence also increases. But Saudi Arabia is a young population. About 70% of the population are less than 50 years. So this becomes a crucial point that people should understand why diabetes is happening and why is it growing at an alarming rate, and they have to take actions to control that.
So can you tell me what are the symptoms of diabetes? How can a person find out if he may be suffering from diabetes?
Unfortunately, diabetes is one of the conditions where they may not have any symptoms at all.
Okay.
A minority of them. But the symptoms are basically because of very high blood sugar in the body. So they can have increased thirst, excessive hunger, and excessive urination. This is the classical triad we say for diabetes. We get polyuria, polyphagia, polydipsia. Other symptoms also can occur because of high blood sugar, and sometimes when the diagnosis of diabetes is made, already they have an end organ damage. Like the person can come with blurring of vision, and the diabetes has been there for many years which the person did not know. Or they may have tingling and numbness in the feet where the nerves are already damaged and they go to diabetes. The other symptoms could be unexplained lethargy, unexplained weakness, unexplained loss of weight. These are some of the symptoms, vague symptoms, which can draw their attention to go to a doctor.
Can you tell me how can one manage diabetes, and what are the latest treatments available for diabetes at the moment?
Okay, for type 1 diabetes, as we know that it is because of lack of insulin, they have to be dependent on insulin for the rest of their life. So the doctor will adjust the dose of insulin. They will have a basal insulin given once a day. And before each meal, they have to supplement with an additional dose of insulin because the glucose surges whenever there is a meal. So depending on the type of meal and quantity of meal they take, there should be a dose of insulin given before each meal to control the blood sugar over 24-hour period. Whereas type 2 diabetes, they have sufficient insulin. So there are measures to control the insulin that is present to make it act better. So because these people are, many of them are obese, so there are non-drug management of diabetes. What is non-drug management? One is weight reduction, and they have to do regular exercise, at least 30 minutes in a day and maybe 5 days a week. It need not always. I get a complaint from patients that it's very hot outside in Saudi Arabia, they cannot exercise. It need not necessarily be jogging in the streets. It could well be just in your home. You can just do aerobic exercises at home, or even in office. Supposing you are going to give a file to a colleague who is 50 meters away, instead of calling, just walk and give the file to that person. Just a simple walking every day, 30 minutes, moderate to severe exercise should be good enough as to start with. And they can be their own quality indicators. Initially, they may just walk, and gradually they can increase the intensity of exercise. Number 2, non-drug management is the type of food they eat. That is smart eating. Reduce the portion or the size you eat every time, and try to avoid very fatty food like the fries, deep fried items. Try to avoid sugary foods like canned drinks, sweetened beverages, sweetened fruit juices, artificially flavored juices, sweetened tea, coffee, and eat wholesome food like whole grains, eat a lot of vegetables and fruits. Try to avoid processed meat, which is very rich in salt, as well as other unhealthy items. These are the non-drug management. When it comes to drugs for type 2 diabetics, there are various groups of drugs available, and the American Diabetes Association has developed an algorithm which is the first drug to start, and depending on the level of the blood sugar and how it is fluctuating, the doctor in charge will add or change medication. There are a big array of medications available, so they will change. So though these type 2 diabetics are initially on medications, a time may come when the insulin may be insufficient in the body to control the sugar. So there may be additional insulin added to these patients when time comes. When the pancreas burns out, it cannot produce any more insulin. There will be a combination of medications and insulin as time comes. Coming to the latest trends in the management of diabetes, there is something known as an insulin pump, which is a device, which is own wearable device, and the patient is wearing and moving around everywhere. And this has got a computer chip inside, and there's a small needle that goes under the skin for delivery of insulin. There's a reservoir where the insulin is stored, and there will be basal insulin continuously given throughout the day. And before each meal, another bolus dose is given by this. And now there are smarter insulin pumps available where the blood sugar can be transmitted remotely into this machine, and it calculates how much to give for this blood sugar level and gives a bolus. So intermittent boluses are given by this machine. There are latest advances also, which are innovations which are happening, like the stem cell treatment and islet cell transplantation. These are things that are going to come in the future, near future.
Thank you so much, Doctor, for your time. It was a very informative session.
Most welcome. It's a pleasure.
Thank you.
Educating the public at large.
Definitely. Thank you so much.
Most welcome.
Thank you so much, viewers, for watching this session.